Morning.
You are from the University College Medical School of London.
That's correct.
You've been invited by the government of Mauritius.
That's correct.
So can you tell us a bit more about your visit?
Sure. I've been invited by the Department of Health and by the Deputy Prime Minister to visit the island to consider a very serious disease called lupus, which is relatively common here in Mauritius as it is in many other parts of the world. So to consider the disease in the island and to see if there are ways in which we can improve the care of the patients.
So where does this word come from, lupus?
Well, lupus comes from the Latin meaning wolf, and it may seem a slightly strange title, but it was named actually by a Frenchman, Pierre Cazenave, in Paris about 150 years ago, and it was because the patients in those days who had very severe rashes, which is a common feature of lupus, were said to look as if they'd been bitten by a wolf, and that's where the name originally comes from, but it's much more than just a skin rash.
And is it common in Mauritius?
Well, as I've said, we think that it probably affects between 1,000 and 2,000 people in the island, and we work that out on the basis of the known fact about the prevalence of the disease in different ethnic groups. We know, for example, in 100,000 people it will affect approximately 40 Caucasians, about 100 people of Asian origin, and about 200 of Afro-Caribbean origin. So translating those numbers to Mauritius, and also the fact that Mauritius is blessed in one sense by the amount of ultraviolet radiation it has, great for the tourist industry, but unfortunately it's one of the factors which stimulates the disease. It's one of the factors which drives the disease, so it's bad for patients with lupus.
And what about the age?
Principally it's a disease of women. About 90% of its victims are women.
Why?
Well, that's a good question. It seems to relate to the hormones, because this is a disease which occurs mainly between the ages of 15 and 40, 45, 50, that sort of age, principally the childbearing years, when we know that the female hormones, the estrogen in particular, is very high. It's noticeable that in children who get this disease, the ratio of females to males falls from about 9 to 1 between 15 and 50 to about 2 to 1, and likewise in the small number of patients who get this disease after the age of 50, the numbers go down again. So it's something to do with the female hormones and the way they interact with the immune system.
Is it hereditary?
It is in part hereditary, but not in the same way that blue eyes might run through the family. The cause of the disease is a complex combination of genes, of environmental factors, hormones as well. And there are clearly certain genes that you inherit from your parents which make it more likely that you will get this disease, but not certain, far from certain. So you won't get this disease simply because you inherit a particular type of gene or set of genes, but only if those genes occur usually in a woman, and usually in association with other factors which are probably something to do with viruses, maybe diet. There's a whole range of things which conspire against the patient to cause this disease.
And what are the symptoms, Professor?
The principal symptom is the classic butterfly rash. It's a red rash across the cheeks and across the bridge of the nose in the shape of a butterfly.
So it starts on the cheeks?
That's where it usually begins, that's right. But not every patient has this. Most patients, however, do have some form of joint pain, arthritis, usually involving the small joints. But the disease may cause inflammation in virtually every single organ of the body. About 30% of patients with lupus have involvement of the kidneys, perhaps 40 to 50% have involvement of the lungs and the heart, perhaps 40% have involvement of the central nervous system, the brain, and a smaller number of patients have involvement even of their liver and their spleen. And the blood tests, or there are many blood abnormalities, so it really is a truly multi-systemic disease.
And does it develop on a long-term basis?
Yes, it often comes on quite gradually, and when you ask patients to go back through their medical history, they will recall, oh yes, well I did have a bit of a, let's say, a skin rash when I was on holiday a few years ago, but I didn't really think much of it, and it was only when the skin rash came back and I had the joint pains they begin to put two and two together. So the onset is often gradual over a period of weeks or months, occasionally over a period of years.
Is there a cure?
We don't have a complete cure for this disease, unfortunately. What we are able to do is to offer control in the majority, but not sadly all patients. But the outlook is much better. 50 years ago, the disease was widely regarded as fatal. The 5-year survival figure was about 50%. So in other words, 1 patient in 2 was going to die of lupus within 5 years. Nowadays, these figures are much, much better. In my own group of patients in London, I look after about 350 lupus patients. We now would expect that about 75 to 80% of patients will still be alive after 15 years. Now, whilst that's much better, you have to remember these cases are occurring in young people. So to say